in a case that John Malpas and Michelle Shankman and I were seeing in the couples project here. And it was a couple who came in for premarital counseling, and they wanted to make sure we understood from the beginning that they really didn't have any problems. They loved each other very much. This was just in case, you know, something came up. And so we worked with them for 3 or 4 sessions just around, they had very conventional concerns about how often do we visit the parents and whose parents and that kind of thing. And they were resolved, and so we were about to say goodbye, and at the end of that session, the wife suddenly said, well, maybe we should come back and talk about our sexual relationship. And I said, oh, yes? You have a sexual relationship problem? And she said, well, we haven't had sex for a month, and we used to have it like, you know, twice a day, or very active. And so I said, yeah, I think you should come back and talk about it. So they did, but they didn't have, they were so vague. Like she would say, well, I don't know why I've lost my desire. Maybe it's this, maybe it's this. And she thought maybe it was what her individual therapist had come up with, which was that she was had a bad body image, or that she was afraid of closeness, or, you know, some of those cliche statements I think the therapists come up with. Myself included sometimes when I can't think of anything else to say. But anyway, so and he didn't understand anything about it either. He said he just kept trying to have sex with her, and so he went off and smoked pot. And okay, so then I thought, well, this would be a good time to do the sculpting. So they'll have some kind of a different language to talk about this. So he stood up and he said, I'm a sponge, and she's a bottle of water. And of course, everything in it was a sexual, had a sexual connotation. And he said, and I am trying to screw the cap off the sponge, off the bottle of water. And I said, okay, show me that. So he goes over and he, you know, he puts his hands on her head, and she's cringing, you know, from it. And I said, well, does that work? No, that doesn't work. Well, what else do you try? I always want to know what they've tried that failed, because then that's a message to them. So he said, well, I don't know what else to do. He said, so sometimes I just follow her around, waiting for her to, you know, give me a drop of water. I did say to him, what would happen if, what's your worst fear about what would happen if you didn't get the water? He said, I would dry up, I would die. So he made that pretty clear how important it was. And so she said that she saw herself as a cube of ice, a huge column of ice, and that he was a flame, and that the flame would come close, and she would want to go to him, but she was afraid, so she would move away, and then it would happen, and they would just go in a circle like that. So I asked her, well, what is her worst fear if she melted? She said that I would become a stagnant little pool of water. It's like with no boundaries. And so that's the way we left it at that point. And we sat down and talked about it. I always review it after I've done the therapy, ask them what they thought about it. They both commented on the fact that they use water, that they have this image of water. So we gave them just a suggestion in the very beginning to go home. And we decided that we wanted to get him out of that very passive position, and we wanted him to do something. So we said, we would like you to go home and find how to stimulate her desire, how to turn her on sexually, and only you will know. because you know her better than anybody else.
Mm-hmm.
So it has to be a way that, not the flame that just melts her, or the just following her around, you know. So he said, okay. And then we told her, we stayed with the image of water with her, and we said, you know, even if you melt, you can turn into something outside of a little pool of water.